here today for your Advanced Lift pre-op. We're going to go over what to expect the day of the procedure, go over a little bit of your history, and go over what medications you will receive prior to the procedure and during the procedure. We'll have you look over the consent. You will also do that the day of the procedure, okay? You have no allergies and you look pretty healthy, so we will be giving you these 3 prescriptions here. You'll take this folder home with you. It has your pre-op and your post-op instructions. So I recommend that you kind of look over those getting closer to your procedure to remind yourselves of the do's and don'ts before the procedure. The first prescription I have here is for Keflex. It is an antibiotic. You will take it 4 times a day starting the day before the procedure, and you will take it until it's gone. You will even take it the morning of your procedure because you're allowed to eat and drink, okay? Any questions over that? So then your pain medication you will receive is hydrocodone acetaminophen. It is like a generic Vicodin and a Norco. You will take this a half tablet to 1 tablet every 4 to 6 hours after the procedure if you need it, if the extra strength Tylenol does not work. You also receive a Medrol dose pack. It is a light steroid to help with any swelling that may occur after the procedure. 2 weeks prior to the procedure, we'd want you to stop smoking if you smoke. You don't need any additional testing because you're pretty young and healthy. We would like you to stop taking aspirin, Motrin, ibuprofen, etc. And any of these things listed here, you can only take Tylenol 2 weeks prior to your procedure. We don't want you to take any blood thinners like fish oil, any of the G's like ginkgo, garlic. You may want to start taking a vitamin C and multivitamin. It will help diminish bruising and swelling post-operatively. You can start that 2 weeks prior. Avoid sun exposure on your face, so wear a hat and sunscreen while outdoors. So when you check in the morning of your procedure, we do our schedule a week ahead of time. We will call you and let you know your arrival time 1 week prior to your procedure, typically by the Thursday before. When you do check in at the front desk, we will bring you back, take your photos. We'll walk you back to a pre-op room where you will change into a t-shirt gown. You'll keep your pants down on. You'll wash your face, your neck, and behind your ears with a special soap. And then at that point, we'll bring you back into the pre-op room. We will give you a combination of Demerol, Phenergan, and Valium, and that will make you nice and relaxed for the procedure. In the meantime, Dr. Mendelsohn will come in, talk with you, answer any questions that you may have at that point. You will get to choose the music that you listen to during the procedure, so start thinking about that. We'll take you to the procedure room. He will do all of his markings and inject with the lidocaine that contains epinephrine. Let that sit again for about another 20-30 minutes. We do the procedure. At the end of the procedure, you will have a dressing that is wrapped around your head. It will be nice and snug. That is to prevent bruising and swelling. You will keep that on all night. Try to stay elevated. If you want to, you can ice your cheek area with some ice compresses, 20-minute intervals for the next 48 hours. We remove your dressing at your 1-day post-op visit.
So remember, Jerry, you're going to look a little swollen, a little like a chipmunk. I know you know, I just keep reminding you so you don't.
I don't think I'll scare myself.
Well, just you never know. It will feel better getting this off for sure.
The good thing was, if she told me to do something last night, I couldn't hear it because of those. I said, honey, it's the first time I can actually ignore you.
And get away with it?
And get away with it.
Or at least have a reason? Yep. Okay, don't panic.
I'm not. No, I think that looks good.
So we're going to go over some things here.
Okay.
Obviously, on both sides, you've got a lot of swelling.
A lot of
You look like a chipmunk.
Mm-hmm.
Underneath your ear on both sides, probably worse on that left side, it's going to look sort of pulled back here. Okay. You sort of look like a cobra.
That's
Okay.
no problem.
So this is going to feel sort of dull and woody.
Mm-hmm.
Okay. So that's why we told you maybe not to shave right now. Behind your ears on both sides, you can see the way it's a little bit ripply back here.
Mm-hmm.
It's a little bit pulled. Same thing. That will settle down and kind of
Okay.
redistribute. But by making those incisions a little bit shorter here, we've got kind of a long edge and a short edge, and we do bunch up that tissue a little bit.
Okay.
So I just don't want you to worry while you're
No,
dealing
I'm
with this.
not shocked at all.
Okay, so your jaw and chin and jawline look great.
Very good.
This kind of pulled look here you will not have.
Okay.
As we discussed the other day, in men, if anything, we see a little bit more relaxation because of the beard, the blood
Mhm.
supply, the weight of the skin, which typically looks quite natural and normal. But you know, Karen might be worried that you look a little bit distorted right now, even though she's seen this. So I'm saying more for her than you. Yeah.
She's seen me hungover.
Okay. Well, all right. Yeah. Well.
Actually, I think he looks great.
I'm very
I think it
pleased.
looks really great for the first day out.
Yeah. So you.
Yeah.
At that time, we will show you, you'll take this bag home with you today. We will show you how to use the products here, the peroxide, the Q-tips, and bacitracin ointment. You'll have this mild baby shampoo. We just don't want any harsh shampoos in your incisions. So once we remove your dressing, we will clean your incision sites here for you, and you'll go home and continue to clean those on your own for the next week until we remove your sutures. Someone will bring you to the procedure. If you are a rewards member, transportation can be provided if you do not have anyone to bring you. After your 1-day follow-up appointment, you will continue to go home and clean your incision sites on your own for the week, and we will remove your sutures at 1 week. When you get home, you'll want to stock up on foods that do not require a lot of chewing. You won't want to stretch your muscle out, biting into an apple or anything. You'll continue taking your Keflex, the antibiotic, until it's gone 4 times a day, and your narcotic pain medication, the hydrocodone and acetaminophen, as needed for pain. But extra strength Tylenol usually works well for these procedures. You will sleep elevated on a couple extra pillows for the first week or 2 after your procedure, depending on how much swelling and things that you have. We want you to stay up as much as possible with your head elevated, but moving around, but obviously rest when you get tired. Avoid bending and lifting anything heavy for 1 week. We don't want to have you raise if your blood pressure rises, it could cause more bleeding and bruising. If you do take the narcotic pain medication, they can be constipating, so you may want to take a mild stool softener and definitely drink lots of water. To minimize swelling and discoloration after your advanced lift, you can apply ice compresses across your cheeks for 20-minute intervals for the first 48 hours. I'll show you how to clean your incision sites at your 1-day post-op. You will need to arrange for someone to bring you to the procedure. They don't have to stay here at the office for the 4 hours that you will be here. If you are a rewards member and you're unable to find transportation, we can provide that for you, but we would like someone that you trust at home to be there to tend to your needs. But they will need to take you back home and bring you to your 1-day follow-up appointment. We want you to avoid pullover clothes for 2 weeks post-operatively, so have a lot of clothes that button or zip up front. No golfing or swimming for 2 weeks, or any strenuous activity such as yoga or Pilates for 4 weeks. Resuming to work depends on the amount of physical activity and public contact that you have, but the average patient is back to work in 5 to 8 days following surgery. Generally, you may resume coloring your hair or perming your hair 3 to 4 weeks following your procedure. And a soft diet. We would like you to stock up on foods that do not require a lot of chewing, because the fact that your muscle has been pulled tight, you're swollen and tight, and your dressing will be on you the first night. It will be difficult to chew. And if you wear glasses, we would like you to avoid having the arms of your glasses rest on your incision site, so have them maybe up higher. You will need to turn your head like you have a stiff neck for 2 weeks post-operatively. Do not stretch your jaw like biting into an apple for 2 weeks post-operatively. And we want you to avoid sun exposure to your face for 30 days post-operatively. Things that can occur during the healing period of your advanced lift. The swelling usually begins in the cheek area and migrates to the jawline and into the neck before gradually subsiding. After you come in at your 1-day post-op, we remove your dressing, but we send you home with a supportive dressing, a chin strap, that should be worn for the next 3 days. After the surgery, parts of your face may feel numb and have decreased or altered sensation. The condition gradually resolves over several weeks. You may experience tightness in the cheek area for the first few weeks to months following the procedure. As swelling subsides and your tissue relaxes, the tightness will resolve. Following the liposuction, there is a continued breakdown of fat and healing of the deeper tissues of the face. This may result in lumpiness and contour irregularities, which will soften and improve over the first few months.